Hi, everyone. My name is Dayne DuVall, and I'm with Nova Southeastern University. We are with the College of Osteopathic Medicine, the Departments of Geriatrics. We have a 5-year grant called the GWEP, and it is the Geriatric Workforce Enhancement Program. And today I'm going to cover some of the helpful tips during COVID. Let me go ahead and share my screen, and we will get started. So, most everybody knows everything. They've been discussed. They probably are disgusted by now about everything that is going on with COVID. So what I want to do is kind of touch on some important things that people may not be understanding, or they've forgotten, or maybe they've gotten tired. So anyway, this is just going to be some helpful tips. Like I said, I am with Nova Southeastern University, and I wanted to provide you with this information. This is information specific to Broward County, Florida. So I want you to understand that people that are 65 and older, or people who are immunocompromised, you're a member of a high-risk group for severe COVID illness. I want you to monitor your health. If you have any of the primary symptoms of COVID, which is fever or chills, cough, which is a dry cough or persistent cough, or shortness of breath, having difficulty breathing, contact your health provider. And I call this the "Don't Be Stupid" number. That's call 911. If it is an emergency, that is what it's for. I recently had a very good friend that said, I can't get to the hospital. And I said, why not? And she said, because my car's broken. Well, yes, they have valet services at the hospital. That's usually not for the person who is going to the emergency department, however. So I call it 911, the "Don't Be Stupid" number. Call the number if you are experiencing any kind of medical emergency, but it's specific for COVID. If you want to, you can call ahead to the emergency department. That's also very helpful to find out, are they seeing people with your type of symptoms. They may refer you to go to an urgent care center if it's not that severe. So keep in mind, monitor your health, and that goes for any types of health or illness that you're currently experiencing. We can't stress enough to wash your hands and sing happy birthday or row, row, row your boat forward and backward. Whatever you do to wash your hands for 20 seconds. And don't forget, if you're in a public washroom, not only make sure that you do all of your hands, but before you turn off the faucet, grab a towel, turn off the faucet, also use that towel to open the door, and also turn off the light if you have to, and then throw away. Don't wash your hands and then touch a substance or a surface that is just already infected. So keep that in mind. Also, wear a mask. I don't care what your predisposition is about masks. I know they're not comfortable. Get a mask. In fact, get 2 masks. CDC is recommending, especially now that we have these variants that are more pervasive, easily spread. We don't know how many more of these variants are we're going to get, but because it's hard to get a medical grade mask, I'm a healthcare provider, and even my supply has dried up. I went to order some stuff earlier today, and they are completely out of stock on everything in PPE. So for a while it was easy to get it, it's now more difficult to get. So if you have N95s or KN95s or a high rated surgical mask, use those. But if not, a lot of people find that wearing a cloth mask, they're very fashionable. We see a lot of people doing that, but get one of those throwaway surgical masks, the blue ones that you stretch, wear that, put that on first, and then put your stylish mask over it. Remember, wash your fabric masks after wearing them. Also, dispose of the cheap masks, wear them one day and then throw them away. If you have the N95s, some authorities say that you can wear them up to 10 days. That's a little bit, depending on what situation you're in. If you have an N95 and you're just wearing it out socially or grocery shopping or wherever you're going, that's probably a good combination. Wear it 10 times and then throw it away. But if you're seeing clients like our patients like I do, then it's a good idea to maybe use them for 2 days, 3 days at max. That's what I believe that I'm doing. When you've worn them too much. Um, I don't know how many of you have ever sneezed into your mask, but it's like blowing your eyebrows off your face and your eyeballs kind of like rolling around. Um, if you've coughed or sneezed, and almost everybody has, into a mask, you know that a lot of those particles go out, go up, go down. Continue sneezing or coughing into your elbow, because when you do that, at least you're keeping a lot of that particles to escape into the air. Um, we have not seen a lot of scientific information. I know at the beginning I was wiping down all of my groceries. I was giving them a bath when I got home. Anything that came in from Amazon got wiped down. We're not seeing that contact with surfaces is spreading the virus as much as it does maybe in the common cold, but still it's a good idea to clean and disinfect your surfaces at home on a frequent basis. When should you seek medical emergencies and get help? Okay, remember, the don't be stupid number is 911. Keep that. I mean, since birth, we've known this number. Use it. If you're having trouble breathing, this or a loved one, or a client, or a resident, whomever your elder is, if you or they are having trouble breathing, then call 911 or rush them to the hospital in your cute little moped or whatever you've got. If you have persistent pain or pressure in your chest, that's emergency medical attention needed. New confusion, that's if you feel disoriented, kind of like woozy, not saying, okay, what day is it? If I've not been feeling good. When was the last time I and you're having conversations with people and you're not making sense, that's when you need to get emergency medical help. Um, if you have a difficulty waking up, now mind you, I'm not a morning person. I'm not awake until I've had my first strong cup of espresso in the morning. Don't even bother me. Once past that, if you're having, those days that you've not felt well, maybe it's the flu or something, when you're not feeling well. If you just can't stay awake or can't wake up, then that's emergency and you need 911 or have someone get you to medical help. Um, Especially if you have blue lips. This is a problem with oxygen flow. My suggestion is get to me and to many of my medical colleagues, temperature is not nearly as important as your oxygen level. $20 on Amazon, you can get one of those pulse oximeters. You put it on your finger. They're pretty correct and accurate. See what your numbers are. If it drops below 94, then you need emergency medical attention. Keep those on hand. That's a much better indication of serious illness with COVID, the oxygen level. And it's also good to keep track of your fever. But I've known cases where EMTs won't even take you to the hospital, even if you have a 103 fever. So keep in mind, they will take you to the hospital if your SATs drop below 90. I can tell you that. So we talked about the symptoms, but here are the most common symptoms of COVID that we've accumulated over the last year of this. Since remember, I'm talking to you the end of January of the year after this was discovered in 2020. So fever and chills, dry or persistent cough, shortness of breath, or difficulty breathing. Those are the first round of symptoms. But tightness or pain in the chest, fatigue, like I said, just laying around, just can't get out of bed, muscle or body aches or joint aches, headache, and that's headache that's not normal or that won't go away even after taking Tylenol or whatever pain medication you take for headaches. A lot of people are saying that they have lost complete sense of smell and taste. That is something that can present by itself with no other symptoms. If you've lost your sense of taste or smell, or even if it is distorted, some people have reported that they smell water and it's purified water and it smells like caca. We're seeing that in some reports. Your distorted sense of smell or your loss of sense of taste or smell, that is a more common symptom. These on the last few that I'm going to discuss right now are less than 10% of people presenting with COVID. Mention these: sore throat, congestion or runny nose, stomach issues, which could be nausea, vomiting, upset stomach, hurt tummy, loss of appetite, or maybe abdominal pain. So those are the most common symptoms of COVID. So keep those in mind, and those are things that you need to check. If they're not serious, get a COVID test. And if you can, get both a rapid and a PCR. The PCR is usually more accurate. Some people say that if you have symptoms, then the rapid test is pretty accurate. I have had 3 rounds of COVID testing, and both times they asked me which I wanted, and I said both times both. The rapid always comes back in less than an hour, usually in a half an hour. And I even had one of my PCRs come back in 20 hours. One came back in 26 hours and one came back in 36 hours. So they're pretty quick. And I like to know that I'm covered on both of those. So if you need those, we have a phone number for you to call in Broward County. The phone number is 954-357-9500. In Broward County for COVID testing is 954-357-9500. And Broward County also provides for COVID testing for homebound. So an elder person who cannot leave the home, is medically homebound, and they are having symptoms of COVID, then what you do is call that number and someone will do a pre-qualifying assessment, and then someone will come out to the house to do a COVID test on a homebound elder. Excuse me. So the Area Agency on Aging of Broward County is a one-stop shop for all things if you have questions about anything about aging services. The phone number in Broward County is 954-745-9779. Again, the number is 954-745-9779. That's the Area Agency on Aging in Broward County. It's funded by the federal government, also local government. But like I said, it's really great information for services for seniors, their families, their caregivers. It includes meals and food assistance, health and wellness classes, legal help, caregiver support, home assistance, and especially towards the end of the year, it's really good for counseling for Medicare and Medicaid, but also that's available year round. They operate senior centers and adult day programs. Unfortunately, most of those have been closed down for a year. Some are opening. I know that there's a senior center in Coral Springs. I just recently did my first in-person education class, my first one in it since this whole pandemic began. Did that this week. I know that they have programs twice a day. They're very limited in size of programs. Also, the AAA, the Area Agency on Aging of Broward County, also can assist with transportation services and also Alzheimer's disease services. So it's a really great organization. And again, that phone number for the Area Agency on Aging of Broward County is 954-745-9779. Also in Broward County, something that some people don't know about is 211. Now, 211 will get a lot of answers for you, but the one thing that I really like about it, it's called the Senior Touch Line. You dial 211 and you register for this. It's anyone that is 60 and older that lives alone. What they do is you decide what time in the morning you would like someone to call and give you a wellness and safety check. Since I like to sleep in when I can, I would tell you to call me at 10 o'clock in the morning. I'm usually up and awake and ready to function. And I'm sure that if I live alone, and I'm 60, but I don't live alone, so I don't need this and I don't qualify for the service, but I would want it later in the morning because by then I'm up and functioning. But what they do is they call you at a predetermined time and they say, "Hey, Dayne, how are you doing today? I just wanted to make sure you're okay and wish you a good day." And you say, "Thank you very much. I appreciate it, Patrick. I look forward to your call tomorrow." And then have a good day. Bye-bye. If Patrick calls Dayne back the next day and Dayne doesn't answer, Dayne might just have gone for a walk and didn't take his phone. But Patrick then, he will call, or he will assign another person to call a few minutes later. And if Dayne doesn't answer the phone after the second time, they're going to call Dayne's emergency contact person. They want to make sure that something hasn't happened. You could have fallen in the middle of the night and can't get to your phone. So they will do a wellness in-person check with you. So that's what that really is, a great service, and it's no cost to our elders that are 60 and above. During this time of COVID, I know a lot of people have gotten depressed, maybe suicidal, just down in the dumps. It's really taken a toll on us emotionally and mentally. So there's two really good organizations here. I'll mention first the South Florida Institute on Aging. I do a lot of education with them. They have a great outreach program. They have an amazing group of hundreds of volunteers that help our elders, and it's elders helping elders, which is really great. So it's people that are 65 and older that are capable and willing, and they volunteer their time and services to be friends with, companions with other elders. There's a foster grandparent program, but they also offer emotional support services. Their phone number in Fort Lauderdale is 954-484-7117. So if you need emotional support services, call, it's called SOFIA, the South Florida Institute on Aging, 954-484-7117. And Broward County Elderly and Veteran Services Division, I do some work with them, and it's a great county program run by some amazing people who are very invested and concerned with our elders in Broward County. Call their number at 954-357-6622. Broward County Elderly and Veteran Services Division is 954-357-6622. They can be reached at broward.org, and you'll look through the listing there, and you'll find the Elder and Veteran Services. And they have their hotline is staffed Monday through Friday, 8 a.m. to 5 p.m. So when should you seek medical help? If you're experiencing any of the following, contact your healthcare provider. Remember, the Don't Be Stupid number is 911. If there's an emergency, dial that number. If it's an emergency for you, for your loved one, for your residents, your clients, whomever, dial 911. If you're having some of the COVID symptoms, contact your healthcare provider. Ask them what you should do. If it's not quite serious enough, but you're concerned about it, get a COVID test. And if it comes back positive, then find out what you should be doing to treat that. There are several different medical protocols. Since I'm not a medical, I am a medical provider, I'm not a licensed clinician to dispense knowledge on all things that you should do. So contact your physician and find out what you should be doing if you test positive. If your chronic health conditions change or become worse, make sure you contact your healthcare provider. Also, any new illnesses or injury, don't be that person who dies because you were afraid of calling 911 or going to the doctor. There have been so many more, I forget, it's somewhere around 400,000 additional deaths that were not COVID related this year in 2020 versus 2019. So that tells us that there are many people who are not getting treated for non-COVID health concerns, and they're either finding out that what they have is no longer manageable, and many people have died. So don't be that person. That's what you can't fix stupid, but guess what? Don't be stupid. What's the don't be stupid number? 911. Don't be that person. Hospitals are not a place to worry about getting COVID. They are the safest place during COVID, as is all healthcare providers, all physicians' office, all medical procedure places, whether they're outpatient, inpatient, everyone is being very careful to protect our patients from getting COVID. Remember, if you're 65 and older, or if you have immune compromised system, then you are a member of a high-risk group for severe COVID illness. Please continue to take precautions. We want you around to see the end of this. And here's our happy place. Just take in that beauty of the ocean and the clouds and the sky, and take a deep breath in and release all the negativity and stress. It helps us to clear our head from what we're going through during this time. And anyway, if you have a smartphone, go ahead and use this QR code. Go to your camera, it'll pop up. Here is a survey for you if you want to take a screenshot of this and do this later, or if you just want to copy it down, I'll leave it up for a little bit. But this is a survey, and the title of this presentation is Helpful Tips During COVID. Presentation title is Helpful Tips During COVID. And we just have 6 questions. They're very simple to talk about what you may have learned, or more things you would like to learn through our programs here at Nova Southeastern University, the Geriatric Workforce Enhancement Program. And again, my name is Dayne DuVall. I'm a licensed massage therapist in the state of Florida, and I'm a certified Alzheimer educator. And my email is Dayne, D-A-Y-N-E, at Dayne, D-A-Y-N-E, DuVall, D-U-V-A-L-L.com. And I really have appreciated your attention today. Feel free to spread this information. This is something that we need to get out there. We need to get very good information out there for resources and helpful tips during COVID. Thank you so much today for your attention, and look for further information coming your way. Thank you very much.